So now we will do another topic of the gingival enlargement, that is diagnosis, how you diagnose the gingival enlargement. So let's start it. Bismillahirrahmanirrahim. So basically they are saying that the gingival enlargement it basically or frequently associated with systematic conditions like diabetes mellitus, leukemia, etc. So the general health and the drug history of the patient should be properly checked, okay, and managed. You should know that the patient's general health and what drugs are taking by the patient, okay. It is a most serious pathologies in the periodontal medicine, gingival enlargement, okay. And you should be careful in differential diagnosis because you have to select a medical approach or medication to basically treat the patient's systematic status also, okay. The correct diagnosis that requires is basically you will take a proper history of the patient. You should know the proper history. Then you will it will lead you to the accurate diagnosis. Okay, gingival enlargement can be localized and generalized. The localized is basically is confined to papilla and generalized is to marginal gingiva. Okay. Previous classifications have also distinguished between diffuse and discrete enlargement, which are actually sometimes difficult to differentiate. Now, basically, in periodontal tissues, indexes are very important for the quantification of the extent and severity of the gingival growth. We have, for example, like grade 1, no signs of gingival enlargement, and in grade 2, there is enlargement but confined to interdental papilla, means it is localized. In grade 2, it is enlargement that involves papilla and margin gingiva. Now, this is diffused, okay, or generalized. In grade 3, it is basically covers the 3/4 or more of the crown, okay. In addition to clinical determination of the degree of severity, more accurate assessment of gingival overgrowth can also be made by models that is cast on the impressions. You can also assess those models for the gingival overgrowth, okay. This was developed a technique developed by Seymour and colleagues, okay, that has been validated by others and can be a valuable tool for the precise determination that gingival overgrowth severity and extent, especially for research purposes and now for also a long-term follow-up, okay. A three-dimensional scanning that can also use to measure the gingival growth and compare the treatment outcomes with the baseline values. You should know it also, okay. Now, for accurate assessment, it is also important to identify the inflammatory and fibrotic components. Also, you should know that what are the inflammatory and fibrotic components. Indexes basically are practically the data that is that allow the clinicians to select the mode of method of therapy. According to that indexes, we select the mode of method of therapy. Either we have to do gingivectomy or gingivoblastomy or non-surgical treatment measures, and for the plan the maintenance phase. So basically, according to that indexes, you basically select your treatment method. Okay.